Communication and collaboration are crucial to delivering greater efficiency without compromising standards of care. Red Embedded Systems has developed a video conferencing service called vConnect, which enables clinicians to deliver accessible and effective care to the patient at home. Paul Brennan reports.
It's morning at Holly Lodge Care Home in County Durham, and Eamon Holmes likes the cake.
That's the best seller, that.
Thank you very much.
But Les Noble, one of the residents here, is due his doctor's appointment. Eamon will have to wait.
Hello there.
Hello, Dr. Chan.
Without leaving the security of the nursing home, in fact, without having to leave his chair, 70-year-old Les can see and be seen by his own GP using a system called vConnect. Does Les mind seeing his GP via the television? Not one bit.
He's got a file on me there, which is, I've seen it, like, and it's very good. It's got everything written down about me, typed out. So he knows what's wrong with me. He's only got a look at the file.
Today's symptoms are an irritating skin rash. Dr. Peter Chan examines the area using the remote camera and prescribes a suitable cream. It's a simple consultation, entirely appropriate for what's being called telemedicine. There were 340 million GP consultations last year. That's an increase of 40 million on the total from 2010. And at a time when GPs are facing budget cuts and 7-day working, the pressure on general practitioners has never been greater. What vConnect can do is bring together doctors and patients in a way that is the most efficient for both. Dr. Peter Chan's Hallgarth surgery covers some 6,000 service users in one of the most deprived areas of the UK. That puts immense pressure on primary healthcare and creates an urgent need to prioritise. So Dr. Chan has been testing vConnect, and he's impressed.
If you try to use this technology for across the board to every single service user, probably not very productive. But if you target it for those who really truly do need it. For example, I would say that nursing home or those housebound patients who actually use the service on a weekly or even daily basis, I would say, game on, let's bring on. Because I can potentially shorten the journey, I can shorten the time taken to get to them, I can actually start to implement treatments a lot quicker than traditional means.
The panel's broken down into different areas that allow you to look at the status of multiple people.
vConnect is not just about video. Diagnostic devices in the patient's own home can be linked to the system and the clinical data monitored remotely via the NHS's own secure encrypted network. Multiple care providers have a single point of access into the patient's home, and the care pathways are shortened. Deployments at Airedale Foundation Trust and with the Lister Hospital in Stevenage have delivered beneficial outcomes. The hope is that NHS commissioning will follow the outcomes and upscale the trials.
We've shown a 45% reduction in A&E attendances, a 9% reduction in length of stay and a 50% reduction in bed days. If that was a drug, there would be a very clear route to market. The problem at the moment with the NHS is that it actually commissions for activity, and what it really wants to do is to commission for outcomes. And services like vConnect can deliver many of the outcomes that the system really wants.
Outcomes that are good for the system and at Holly Lodge good for the patients. By using the TV and portable tablet devices, it's reduced the disruption that a trip to the surgery can cause.
Especially with people with dementia and they're leaving an environment where they're not used to, it can be really making them anxious and upsetting and unsettling, and then that would have a knock-on effect. So where you have the tablet would go to their room and be supported by the carer or the nurse that's there.
The NHS 5-year forward view talks of new partnerships, integrated out-of-hospital care and more care being delivered locally. vConnect certainly seems to tick those boxes if commissioning follows the desired outcomes.
Okay, bye-bye now.